Hey guys, Dr. Rich here at the Teamthompson office. Today we're going to talk about spinal decompression, okay? So this is something that we have in all of our offices, and we have it for patients with neck pain and lower back pain. So clinical indications for spinal decompression, usually if a patient has any sort of lumbar herniation or a disc bulge, any sort of degenerative disc disease, usually most patients prior to putting them on the machine, we usually have some sort of imaging, whether it's an x-ray or MRI, just to double check. But basically what it does is it just basically stretches out in the spinal level, helps decompress the spine and speed up the recovery process. So if you look at the actual spinal model, you have your vertebrae with the disc, the intervertebral disc, in between each vertebrae, which you need, otherwise you'll have bone on bone. So what actually happens with a bulge or a herniation, this is just an example of a herniation right here. So a lumbar lower level, low back, a lumbar disc bulge is when the disc actually bulges out a little bit, but that has not ruptured yet. A herniation is actually when it ruptures and that liquid comes out. And if you think of a jelly donut, if you squish a jelly donut, it's a very similar type of thing. The problem with that is that liquid in general is inflammatory when it's outside your disc and when it's coming out towards your body, and it can press on those nerves and it can cause symptoms such as severe pain in the lower back. It can cause like sciatica pain, so referred pain going down your leg, numbness, sharp shooting pain. So basically what we're doing with spinal decompression is we're just kind of decompressing, opening up like that, and by doing that, by pulling just like that, you're kind of creating a vacuum effect, and that helps the inflammation and all that jelly suck back into the disc quicker, so it speeds up the recovery process. How this helps our patients is it helps if they have any sort of radiating pain going down their leg. It starts to centralize. They start to feel it more go up towards their back, so it goes back to that pain source where it's originally coming from. The only side effect would be some soreness, but we usually do ice in the office, some electric stimulation therapy that'll help loosen it up a little bit. Okay, but this is a therapy that we have in all our office. We have it for neck too. So if we have a patient with cervical disc herniation, cervical disc bulges, degenerative disc disease, any sort of arthritis, as long as it's not severe arthritis, you could potentially be a candidate for it. Okay, so we have patient Jen here. Jen right now is doing spinal decompression for her lower back, her lumbar spine. Okay, so even though she's on her stomach, we have all different ways to set up a patient on spinal decompression. So we can have a patient flat on their back, flat on their stomach, which she is right now. We could also, if they feel more comfortable with their legs flexed down, we can actually lower that portion a little bit, okay? We can also have a patient flat on their back, or we can have them on their back with their knees and legs elevated. You know, there's some patients, when a patient has like a herniation or any sort of condition, spinal condition, they usually have a direction of preference, which is like a certain position that they feel more favorably, and we want to put them in that position because it'll help give them more relief. And then we also have, just for patient comfortability, I'm going to give Jen this little button right here. We call this the kill switch sometimes, but it's just like a safety button. So if the patients, while they're on this, if they feel uncomfortable, we just have them press that button, and it just shuts off the machine, just in case, because we just want the patient to be comfortable. But that's it in a nutshell. It's basically around 10 to 12 minutes, depending on where the patient is at on their decompression settings. And we have different settings that we put them on. So right now, Jen is on just a comfortable, what's called a back short setting. So it's pulling, it's resting longer than it pulls. It's resting at least double the amount of time it's pulling, but we have other programs. We have programs that pull for a little bit longer for patients who are more advanced in the program, but it depends on the patient. It depends what they're comfortable with and what they're getting relief with.